Malingering is when an individual fakes or significantly exaggerates physical or psychological symptoms in order to gain external benefits. While it's not classified as a mental disorder, it's included in the DSM-5 under a V code, which is other conditions that may be a focus of clinical attention. This is because malingering can affect the diagnosis and treatment of a patient, whether the malingering is indicative of other underlying conditions or issues in the individual's life. While motives will vary from individual to individual, common motivations for malingering include financial compensation, revenge, obtaining drugs and prescription medication for use, avoiding or reducing criminal charges, avoiding military draft, and avoiding distressing situations and environments. However, it's incredibly hard to make generalizations, as the demographics and motivations of malingerers are incredibly diverse, and because of this, the majority of theories that have been proposed have failed to fully explain the factors that motivate malingering. However, there are two psychological models that remain relevant. These are the criminological model, which suggests that motivation to malinger is rooted in a disregard for social norms and laws in socially deviant individuals who use malingering as a tool to achieve their goals. While this theory is relevant, it's not applicable to all cases of malingering. Then, there's the adaptational model, which proposes that malingering is an individual's method of coping with extreme stress. There are several assumptions that accompany this model. 1. The patient sees the diagnostic process as involuntary or antagonistic. 2. The patient cannot see any alternative ways of achieving their goal. And 3. The patient believes that there are no other ways of achieving their goal. This theory has also been supported by recent research that indicates that malingering is a situation-specific tool rather than a trait. When faced with a possible case of malingering, the best approach to detecting it is through a combination of tests, reviewing the patient's medical history, and looking for indicators of malingering in the patient's behaviour. However, before a patient is considered a malingerer, it is also important to consider differential diagnoses such as vestigious disorder, which is where a patient fakes or exaggerates symptoms in order to be seen as a sick person, and physical diagnoses such as chronic illnesses, because the symptoms of these conditions can resemble malingering. Also, because malingering is not a mental condition, it cannot be treated with traditional therapy or medication. Rather, the malingerer should be indirectly confronted, as malingerers will only stop malingering when they either achieve their goal or give up because pursuing it is futile. However, it's important to treat malingerers with empathy, as malingering can be the result of other underlying issues. In this way, the malingerer is able to stop and save face, and the psychologist is still able to offer help that is better suited to their needs.